Great to see you as always.
Good to see you. Thanks for having me.
All right, so what do you make of Oregon's governor telling residents to call the cops on their neighbors if they see people violating COVID restrictions? I mean, 6 people from 2 different households. I don't even know what Thanksgiving gathering has that many people.
Well, I have been told that you can have 15 for a funeral, so people are starting to say it's a funeral for their turkey. So there are ways to get around this. But seriously, I don't know who elected this Karen. These busybodies think that they can dictate to us everything we do in our life and how we live our lives. Nothing in our country, nothing in our country's history ever indicated that we would live in a world where one person would dictate all of our behaviors. But even from a practical point of view, if you look at the data on this, the objective evidence is we've been putting more and more mandates on for the last 6 months. We have now more mandates than we've ever had, including these new ones. And guess what? We have more incidences of COVID positive patients than we've ever had. So there's no indication really that any of these lockdowns or any of these mandates have slowed this down. In fact, I think the Wall Street Journal put it best when they said the virus is insidious. It's largely spreading regardless of human behavior. And really the only thing that's going to slow it down is a vaccine. And I think we take our eye off of that prize, the vaccine, if we keep saying, oh, just wash your hands and this thing's going to go away.
Right.
Guess what? It's not going away until we get a vaccine.
Dr. Tom Inglesby, the director of the Center for Health Security at Johns Hopkins Bloomberg School of Public Health, says this, that we're seeing a new spike in cases because people aren't acting with a common purpose like they were back in the spring. I want you to listen to this and react.
Unlike the springtime, when the country really was acting kind of with common purpose around March and April at the start of this pandemic, and where the virus was located in comparatively fewer places, the epidemic now is surging in almost every state in the country.
He's got it completely back.
So you nodded your head. You disagree.
Well, he has it completely backwards. If you look at mask usage, in March and April, the CDC and everybody, the WHO, were still saying masks don't work. So nobody was wearing masks in March and April. Now, anywhere between 70 and 90% of the people are wearing masks almost all the time. If you go to a store anywhere in Kentucky, once you enter, you're wearing a mask. We have nearly full compliance with the masks in Kentucky, and the cases are exploding. There's no evidence that any of these mandates are slowing down the vaccine. And when he says things like that, what he's telling you is he's ignoring the science. He's ignoring the evidence that this virus is exploding exponentially right now. But the other thing is there's an aspect to this that is good news. We have 5 times more daily cases than we had in the spring, but we have half as many deaths per day. So that works out to about an 80 to 90% reduction in mortality. Still means we have 1,000 people or more dying a day, and that number's rising, and that's terrible. But the good news is if we were having the same death rate we had in the spring, we'd be having 10,000 people die a day. So we have come a long way. Therapeutics, and the people who are spreading this are in a younger age group. The vast majority of them don't even know they're having it. So while there is a age group that's really affected, it's not everyone. We need to put this all into perspective.